time now to our Debate in Diabetes segment. When it comes to type 1 diabetes progression, what's to blame? Beta cells or immune cells? Here to debate both sides are Dr. Edward Phelps and Dr. Jamie Felton. Our thanks to you both today. All right, Dr. Felton, I want to get started with you because you argue that immune cells are doing the most damage. How so?
Yes, so I think the first indication that we have that anything is going on in type 1 diabetes are the presence of autoantibodies, which is indicative of an autoimmune response. So that's the earliest thing that we see. As disease progresses, we know that the immune response is required to continue to drive that beta cell destruction. There are many people who may stay in the early stages of type 1 diabetes that don't progress, and often that is because the autoimmune response is not active. I think we've seen that in animal models and also in models of therapy.
Dr. Phelps, this is a very hot topic, hotly debated. You argue that beta cells actually do have a significant role in type 1 diabetes progression.
Yeah, I think there's quite a lot of clinical evidence that at onset, at diagnosis, there's a significant remaining beta cell mass, but there's very little insulin secretion in response to glucose. But there is a remaining response to other secretagogues. So that's very suggestive that the beta cells that are there are dysfunctional. So I think if we're talking about progression from stage 1 to stage 3, beta cells have a critical role to play.
And is this a new idea or a new concept, the role that beta cells might play?
Well, you can go back in the literature and you can find papers all the way to the early 80s talking about beta cell death. Is it suicide or homicide? Okay, so I think this is not a brand new idea, but there's a lot of new evidence coming out in recent years.
And do you feel like physicians are taking a closer look at beta cells?
Yeah, I think that's really important because if you're going to treat someone with type 1 diabetes at diagnosis and get them back off insulin or insulin independent, you can't just stop the immune system, you have to reactivate the remaining beta cells.
And recent studies have indicated there's actually interplay between beta cells and immune cells when it comes to contributing to diabetes. Can we make the argument that they're both to blame?
I think we can, but this wouldn't be a good debate.
We're not here to agree.
I have lots of respect for Dr. Phelps, my opponent, and I do think in all of the things that we debate, there is interplay, and there are important considerations to be mindful of, especially when we're thinking about therapy. However, I will maintain that the primary driver is the immune system.
Dr. Felton, though, would you argue that only treating immune cells, would that be a successful path forward in the fight against diabetes?
I think that's a really interesting question because many people would say no because we have not been able to do that. At the same time, we probably are not treating the immune system at the right time point in order to be able to do that. So I do think there's potential, maybe not at the time points we're treating it now, but I do think there's potential.
Dr. Phelps, would you be one of those people that would say no?
Well, again, I have a lot of respect for my opponent.
I love how cordial we are here.
And her position, but I think if you only treat the immune system, that won't be sufficient.
All right. Do you feel, though, that by acknowledging the role and then subsequently treating beta cells, the role that they play in type 1 diabetes, that we could actually start to see some real progress?
Well, I take issue with the point that start to see real progress because I think we actually are seeing real progress on many fronts. And if you just attend the sessions at this meeting, you see beta cell replacement, you see immune therapies, which are starting to have progress for patients, clinically. But in terms of actually reversing type 1 diabetes, then I think, you have to deal with the beta cells.
Final thoughts to you both when it comes to the path forward on either stopping the progression of type 1 diabetes or reversing it. What's the best path forward?
My bottom line is that type 1 diabetes is an immune problem that leads to an endocrine defect, and so we need to address the immune system.
My bottom line is that the beta cells are a significant contributor to type 1 diabetes, and if you don't find a way to stop their dysfunction, you won't be able to reverse the disease.
Thank you both for your thoughts and for possibly the most cordial debate we've had to date. Thank you both. Appreciate your time.